All right. I think we still have some people dropping in, but I'm going to get this kicked off. Thank you, everybody, for joining this latest series in our water management and planning series that we've been offering throughout the year. Today, it's navigating evolving water management regulations, ensuring compliance, and public safety. A couple little housekeeping items before I pass it on. There's a Q&A at the top. You should have in top bar. If you've got any questions throughout or at the end, we'll have some time for Q&A at the end of the webinar. So please feel free to type in your questions as we go along. There will be a recording available for this, probably coming out about middle of next week. So if you have to step away, missed it, want to forward it on to a colleague, there will be a recording of this webinar as well. And with that, I'm going to pass it over to our expert today, Spenser Johnson, Director of Water Safety and Management for Barclay Water Management. Really a treat to have you here. I know we're going to learn a lot about water management. So with that, I'm going to stop talking and pass it on to you.
Thanks, Greg, and thank you to Chicago Faucets for having me today. Okay, so today we are going to go through navigating evolving water management regulations, talking about how to ensure compliance and public safety. So I'm Spenser Johnson. I'm the Director of Water Safety and Management for Barclay Water Management. I've over 8 years experience in the Legionella and water management and consulting field, and I've surveyed over 100 facilities, gone on site and performed their risk assessments. I'm an ASHRAE 12080 Legionella Water Safety and Management Specialist, and I provided outbreak investigation support during when facilities are going through those hard times. So a little bit about what we're going to go through today. First, we're going to start off by talking about Legionella bacteria, going through an overview of that and what some of the sources that you find that in building water systems. We're going to discuss how to create an effective water management program. We're going to talk about the latest water management program regulations that are out there and standards and guidelines. We'll discuss testing and monitoring requirements, and then we'll go through what some responses and remediation strategies are if you're to get positive results. So first, we're going to take a look at an overview of Legionella bacteria and biofilm. So Legionella bacteria, it's a naturally occurring bacteria. It's coming in through your incoming water supply, and it's safe when it's in the natural environment. It's a gram-negative rod-shaped bacteria. There's over 60 species of Legionella and 70 identified serogroups. And Legionella pneumophila is the one that you hear about most often because that's the species that's responsible for 90% of human infections. And there's two main growth factors for Legionella bacteria: temperature, which we're going to take a look at in the next slide, and also nutrients. And usually those nutrients for growing the bacteria can be found in the biofilm that's within your plumbing. So when we're talking about temperature for Legionella bacteria survival, this is a chart that's showing the temperatures that Legionella bacteria thrives at. So like I said, it's a naturally occurring bacteria. It's coming in from your incoming water supply. And at temperatures of less than 68 degrees Fahrenheit, that's when the bacteria is usually dormant, but it's still viable and it's not multiplying at that. And then at the 90 to 110 degrees, that's the optimal multiplication range for Legionella bacteria. So that's usually where you see a lot of your fixtures are at that temperature range. Your faucets, your showers, they're usually in that optimal growth range. And then at the higher temperatures, that's when you start to see the bacteria die off. So at a greater than 122 degrees, that's when you're going to kill 90% of Legionella bacteria within 2 hours of contact time. And then at greater than 140 degrees, you're going to kill 90% of Legionella bacteria within 2 minutes of contact time. And then at greater than 158 degrees, that's going to be a rapid instant kill of the bacteria. So what is legionellosis and why is it so dangerous? Legionellosis, it's caused by Legionella bacteria, and there's two main diseases that are associated with it. Legionnaires disease, it's a serious type of pneumonia, and people can get sick when they accidentally breathe in mist or swallow water into the lungs that contains Legionella. And it needs to be diagnosed and treated with antibiotics to be cured. And since it poses as and can present as pneumonia, this can be a challenge for diagnosing it because there are many illnesses that present this way. And the other disease that's associated with Legionella bacteria is Pontiac fever. It's a milder infection and it clears up on its own without antibiotics. So when we're talking about Legionella risk management, we're usually talking about preventing Legionnaires disease because people can and do die from it. There's been no known deaths associated with Pontiac fever, but by managing our risk of Legionnaires disease, we are also managing the risk of Pontiac fever because the transmission is going to happen through the same route. When we're looking at public health impacts of Legionellosis, health departments have reported that there were nearly 10,000 cases of Legionnaires disease in the United States in 2018. And according to a National Academy of Sciences study, there are an estimated 52,000 to 70,000 cases of Legionnaires disease annually. And this is showing you that the diagnosis rate is much lower than the estimated number of actual cases. And this is because it's hard to differentiate when it's presenting as pneumonia. And according to that NAS study, there was an estimated 33% of the Legionella infections led to death. The CDC is reporting that there's a 10% case fatality rate and a 25% case fatality rate if it's acquired in a hospital. And there was another study that estimated that 3,359 emergency department visits are for Legionnaire's disease, and 91% of those are resulting in hospitalizations. And we've seen the reported cases of Legionnaire's disease grow in the US by nearly 9 times since 2000. So what are potential sources in building water systems that for Legionella bacteria growth? Cooling towers, faucets, showers, decorative fountains, all of the sources that we list here do pose risks per the CDC because they have these potential modes for transmission through direct contact with the water, ingestion, indirect contact, potentially inhaling the aerosols and contamination of that. And all of these pose a risk for potential Legionella transmission. So when we're looking at Legionnaire's disease, there are 4 factors and events that lead to Legionnaire's disease: entry, growth, transmission, and exposure of a susceptible human host. When we're looking at entry, we know that Legionella, it's present in your natural water and it can come into your building from the municipal water supply. Looking at growth, most facilities are receiving their water from the municipality, and the disinfectant levels that you get from that municipality can fluctuate, and the levels often decrease as you move throughout the building's plumbing system and get further away from that point of entry. And if the water system is not properly maintained, then you can provide an environment for Legionella bacteria to grow and thrive. And transmission, building water sources such as cooling towers, showers, everything that we listed on the slide before, they can become a health problem when someone breathes in water that contains Legionella bacteria, and then it ends up into their lungs, and they can potentially, depending on their susceptibility, grow and develop into Legionnaire's disease. So on this slide, we're going to focus on growth because this is our opportunity to disrupt the system and manage Legionella bacteria in the water. And some of the ways that we can do that are by increasing your hot water temperatures of your hot water system to kill Legionella bacteria. Like I said, that optimal growth range is that 90 to 110, and we're going to start killing off the bacteria at 122 degrees. So trying to set your hot water system at one of those higher temperatures to stay out of that optimal growth range. Piping complexity and system design, those are hard after your facility has been built, but usually complex plumbing systems do experience disinfectant residual decreases as you move throughout the facility. And another way to control the growth is through flushing. making sure that your water is consistently moving through your building water system. Stagnant water is going to allow for conditions for biofilm to build up, create a place for bacteria to grow. So make sure that you're flushing your building's water system often. And creating a water management program, it's one of the most effective ways that you can identify the risks in your facility and pinpoint where Legionella can be managed. And when we're talking about Legionella guidance, there's a few documents to consider. So guidelines, those offer recommendations or advice, and those are like similar to ASHRAE Guideline 12 and the CDC toolkits that they've released. Standards are setting criteria and specifications like ASHRAE Standard 188, ASHRAE Standard 514, and the new AAMI Standard ST108. And regulations are building off of those standards and guidelines and are enforceable and can have legal consequences if they're not being put into place because they're mandatory requirements and they can be state specific and also facility specific requirements. So in the US, ASHRAE was really considered to be the pioneer of Legionella risk management recommendations. It first started with ASHRAE Standard 188, which was published in 2015, and they most recently updated it in 2021. It's not enforceable unless it's written into law, but they did write this standard throughout with enforceable code intended language to facilitate the adoption of this standard for regulatory purposes. And we've seen it written into regulations for New York City, New York State, the Center for Medicare and Medicaid Services, Joint Commission, and within the publication, it includes a description of the environmental conditions that promote Legionella growth. It has informative annexes, bibliography, recommendations, and references. So ASHRAE Standard 188, it's going to tell you how to implement a water management program, what types of facilities should implement a water management program, but it doesn't give you a lot of guidance on how to minimize your risk of Legionella bacteria growth. And that brings us to ASHRAE Guideline 12. That has the best practices, how-tos, includes the control measures. And together, these two documents are considered to be the gold standard of implementing a water management program that's focused on managing the risk of Legionella bacteria growth. And this is looking at the other than standards and guidelines that are out there that are considered when you want to create a water management program. So in 2017, the Center for Medicare and Medicaid Services, they introduced their memorandum that required all CMS-funded healthcare facilities to put a water management program in place. And they were clear that they wanted you to have a water management program that didn't just address Legionella, but it also addressed other waterborne pathogens that you would find in biofilm. And they also want you to have a water management program that's addressing the physical controls and other parameters that can affect the growth of Legionella bacteria. The Joint Commission's Water Management Program Standard was released and went into effect in January of 2022, and that focuses on all Joint Commission accredited hospitals, critical access hospitals, and nursing care centers, and they have 4 elements of performance that they're looking for you to follow. They need you to have a water management program in place. You need to have a water management program team that's meeting regularly to discuss and make sure that you're implementing the water management program. You want to identify where your control locations are and what corrective actions you have. And then your water management program needs to be updated on a regular basis. ASHRAE has also released a newer standard in 2023, ASHRAE Standard 514, and this is focusing on other microbial hazards within building water systems. Previously, with ASHRAE Standard 188, they focus solely on Legionella bacteria, but with this new standard 514, they're also looking at other opportunistic waterborne pathogens, and it's looking at the potential physical and chemical hazards that are within a building's water system. The CDC has also created a water management program toolkit, and that endorses the ASHRAE Standard 188 approach. And then there's been a newer standard, AAMI ST108, And this is focused on your sterile processing department, and they want you to have a water management program in place and perform a risk assessment specifically of that sterile processing department, and then perform some routine testing to confirm that your water is meeting the water quality requirements outlined in ST 108. And then next, we're going to take a look at what the different regulations are that have been released for water management programs in Legionella bacteria. And this is an overview of them, but we're going to go into each state in more detail in the next couple of slides. So first, we're going to take a look at New York City and New York State. They were the first kind of areas to first implement a water management, requiring facilities to have water management programs and requiring Legionella sampling. For water management programs, they require healthcare facilities that have patients that are staying over 24 hours or more to perform a risk assessment and create a sampling plan. And then they also want facilities that have cooling towers to have a maintenance program and plan. And the maintenance program and plan is focused solely on your cooling tower. For both New York City and New York State, they have specific regulations. They want all towers to be registered within the state or the city. They need Legionella samples to be taken every 90 days, and they're very specific about that 90-day window. If you take it on day 91, you are out of compliance. They want you to take inspections of the tower on a regular basis, and they also have action limits for when you're responding to positive results. And then for Legionella sampling, they outlined that healthcare facilities need to take Legionella samples on a regular basis, taking samples from your building water system's hot water loop, and then from your cooling towers, taking them on every 90 days. And for both your cooling towers and your domestic water, they have action response limits. For New York State, if you get a positive result over 20 CFU per milliliter, they need you to respond to those results and perform a disinfection, potentially a cleaning, depending on what the levels are like. And then in New York City, similarly, you're responding at levels of greater than 10 CFU per milliliter. And then for your domestic water system, they look at percent positivity overall. So depending on how many samples are positive out of, say, 10 samples, if you get 5 samples that are positive, they do require that you take a remediation action, something of doing a monochloramine remediation, a hyperchlorination, and implementing that, and then doing a resampling. The next regulation that we're going to talk about is for New Jersey. This is one of the more recent ones. New Jersey passed their Senate bill, Bill 2188, and it's going to go into effect in September of 2025. The goal of this bill is protecting high-risk individuals, and it outlines what types of facilities are going to need to have a water management program. So they're requiring hospitals, long-term care facilities, buildings with a centralized hot water heater, including residential high-rise buildings that have more than 6 stories. They're looking at senior housing facilities with 25 or more units, hotels with 25 or more units, and correctional facilities will all need to have a water management program. So New Jersey is following very closely to ASHRAE Standard 188 and ASHRAE Standard 514, which types of facilities they require to have a water management program. This is newer because most of the regulations that we've seen so far have focused mainly on requiring healthcare facilities to put a water management program in place. And New Jersey is expanding that scope by including hotels, housing facilities, and correctional facilities as well. They want to make sure that the water management program that you put into place is meeting the criteria that's outlined in ASHRAE Standard 188, ASHRAE Standard 514, or any comparable standards. And routine Legionella and bacteria samples may be included in a facility's water management program. They are not, at this time, they're not requiring Legionella samples to be taken. The next state that's also put into effect water management program requirements is Ohio Code 3701-22-07. This one went into effect in September of 2022, And it requires hospitals to implement water management programs that take steps to manage the risk of occurrence of transmission of waterborne pathogens and to perform validation Legionella testing on your building water system. So hospitals, they need to establish and implement an effective water management program and identify hazardous conditions that takes the steps to manage the risk and occurrence of Legionella transmission and growth. Hospitals, they're also requiring hospitals to perform Legionella sampling, and they're specific about the samples that you need to take. They want you to have samples that are representative of all the hot water potable loops that you have and the water sources that you've identified during your risk assessment as potential areas that have conditions for waterborne pathogen growth. And they say they want your testing to include at least one sample from your building's point of entry. They want a minimum of representative samples to be taken from distal outlets throughout the facility and making sure, again, that you're including each hot water system that you have. And then they also want you to take water quality parameters while you're doing this. So during the time of sampling, they want you to be taking temperature, pH, and chlorine. That way, when you get your results, you can review if there's been any stagnation, maybe there's an issue going on, so identify those throughout the water sampling. And then if there is a presumptive Legionellosis healthcare associated case, the code also outlines that you want to coordinate with the Ohio Department of Health or your local health jurisdiction to work with them on what responses you should be taking. Illinois has a policy that's requiring Legionella testing at specific frequencies, and it's based on ASHRAE and the CDC guidelines. And this one is focused on skilled nursing and intermediate care facilities. It went into effect in June of 2022, and it outlines that the facility should develop a policy for testing its water system for Legionella bacteria. You want the policy to include what type of testing is being taken. You want to know what your corrective actions will be if you're to get positive results. And they also want you to perform a risk assessment. They want it to be based off of ASHRAE Guideline 12. And at minimum, you need to include a water management program with this, your risk assessment, and then also how you're going to take corrective actions within that. So just looking at each of these states as they're kind of coming up with these newer regulations, I wanted to put this table together to outline what the requirements are for each state. Right now we're seeing with New York, they are requiring facilities to have a water management program focused on healthcare facilities, and they do outline that you need to perform Legionella testing. Currently, New Jersey is only requiring you to have a water management program. They don't require Legionella sampling as part of the regulation. Ohio is focused on both having a water management program in place and performing Legionella sampling. Similar with Illinois, they focus on having a water management policy, not a program, but very similar, and then taking Legionella samples as well. So we've talked about a lot of regulations and standards that are focused on how to, creating a water management program, but how do we actually go about doing this? There are 6 steps for making a water management program based on ASHRAE Standard 188. You want to first conduct a risk assessment. Next, form your water management program team. Create flow diagrams of your building's water systems. Establish your control locations where Legionella risk can be minimized. Come up with a procedure to verify and validate your water management program, and establish a method for documentation and record keeping. And we'll go through these in more detail on the next couple slides. So during a building risk assessment, you want to do that first by conducting a water system survey. You want to take a look at all the different types of water features that you have in your facility. How many points of entry do you have coming into the building? What types of hot water heaters do you have? Do you have tanks, or do you have instantaneous heaters? Are there any cold water storage tanks? You need to determine all the different points that you have in your building's water system that have the potential for Legionella bacteria growth. And ASHRAE kind of, what they do in ASHRAE Standard 188 and ASHRAE Standard 514 is they have two tables that help you determine if a facility needs to have a water management program. First, they focus on the building itself. So does your building have a cooling tower? How many floors does your building have? Could it have, a more complex plumbing system? Or do you have additional water features that have the potential for Legionella bacteria growth with misters, atomizers, potentially a decorative water feature, any hot water storage tanks, all of these types of water features that have the potential for growth and then would make your facility need to have a water management program. And then the other table from ASHRAE Standard 188 and ASHRAE Standard 514 is looking at the populations that the building is serving, because we want to take a look during this risk assessment as well to consider what occupants are staying in the building. Are there more susceptible populations that are in this facility? Do you have immunocompromised individuals, high risk units where there's a higher potential, high exposure areas, respiratory therapy? Anyone could become infected with Legionnaire's disease, but immunocompromised individuals and people that are at the highest risk are these, high risk patients. So it's important to make note during our survey as well where these types of units are within the facility. And then next, you want to form a water management program team. So these are going to be the individuals that are coming together, reviewing your plan, and then potentially responding if you ever get positive results or if there's an outbreak situation. So you want to have a couple of different people involved to make sure that you have an effective water management program team. And they're also helping to ensure that the water management program is being verified and validated to make sure it's working correctly. So usually a strong water management program team consists of members from different areas like facilities, engineering, infection prevention, EVS, housekeeping. It's also important to have a senior management member on the water management program team so that you have their buy-in just in case, you need to do a water shutoff or in case of construction or an outbreak situation, then you have someone that's involved with the plan and can help make those decisions quickly. And then the next element that you would include in your water management program is going to be a basic flow diagram that maps all of your building water sources. You want these diagrams to be simplistic so that everyone that's on the team can easily understand the flow diagrams. So they should be showing where the water is entering the building, what type of cold water sources do you have in the building, how the water is being heated, do you have tanks, do you have instantaneous heaters, is there a mixing valve there, the temperatures that the water is being heated to, if there's any recirculation lines, and then what hot water fixtures it's being sent to. And you want to create one of these flow diagrams for each of the building's water systems. Then next, you want to identify your control locations. These are the areas that are going to allow for bacteria to amplify or potentially expose people to bacteria. And together as a water management program team, you're going to decide how you want to control the potential amplification of bacteria at these sites. So are you going to routinely flush or disinfect outlets? Maybe you'll increase the temperature at your hot water heaters to greater than 140 degrees to help kill off the Legionella bacteria. And these are parameters. This is what we define as your control limits. So for each of your critical control points, you want to identify what actions you're going to be taking. For each of those actions, you're going to want to identify what your control limits are, and then determine how frequently you're going to do that and who will be in charge of each of those. And then what you also want to do is determine if you're outside of those control limits, what corrective actions you'll be taking to make sure that you're getting back within range of those control limits. And then next, you want to make sure that you have a process for documentation. One of the things that we like to say is, if you don't have documentation, you can't prove that you're doing what you say you're doing. So documentation is one of the most important things of your water management program, so you can prove that you're doing what you say you're doing. So if you are taking, Legionella samples, having that Legionella report on hand. If you needed to perform a cooling tower disinfection due to high levels of bacteria, having a disinfection report available. For every action that you're taking, you need to have documentation for it. And then if you were outside of those control limits that we've identified, for every corrective action that you're taking as well, you want to have documentation so that you can prove you're doing what you say you're doing. One thing that we do recommend doing is keeping a history log. This will help you note any major changes that you have to your water management program over time, and it provides you with an understanding of your most recent updates to your plan at a quick glance. ASHRAE does require you to verify and validate your water management program, and some examples of this include you can have regular meetings as a water management program team, discuss any actions that are being taken and completed, and you want to be clear, delegate which team members are responsible for each action item. You want to discuss any major changes that there have been to the building's water system. Have you done any construction recently that you need to make a note of? Is there part of the facility that's currently unoccupied and maybe additional flushing needs to be implemented in that area? And then lastly, you want to make sure that you're updating your water management program on an annual basis. ASHRAE, the Joint Commission, and the CDC Toolkit all recommend that you update your water management program at least annually. It's something that, they don't want you to have this plan and this risk assessment that you performed one time, and then you've created this document and it sits on a shelf and then never to be looked at again. These water management programs are living, breathing documents, and they need to be updated on a routine basis so that they're always meeting the latest standards and guidelines that are out there, and also for your site to make sure that you're making any updates and changes to your building's water system. So why should you create a water management program for your facility? There's a couple of different reasons. Compliance with regulation, improving your building water system operations. But the most important reason why we're doing this is for the safety of your occupants, visitors, and staff to your building. And once you begin and create your water management program, you need a way to validate that the plan is working. And when you're talking about validation, there's a couple of different options that you have available to you. You can test for disinfectant residuals. That'll give you a good understanding of, taking a sample at the point of entry, seeing what the disinfectant residual is from the municipality, and then taking samples throughout from the beginning, middle, and end of your building's water system to get an understanding of how that disinfectant residual is dissipating as you go throughout the facility. You can take Legionella samples, taking it from representative outlets throughout the facility, ice machines, hot water heaters. That will give you results, let you know either there is Legionella bacteria growth and you need to implement a corrective action and respond to that, or everything is working and we can continue on with that. Taking samples for lead in areas where people might consume the water, and taking total bacteria and HPC samples and coliform bacteria. So each of these tests, it is going to give you a different perspective on how your control measures are working. But one thing that you do want to keep in mind is that if you're looking to control Legionella bacteria in your building's water system, and that's what you're looking to validate, the most effective way to do that will be through Legionella testing. And when we were talking about Legionella testing, the live culture method, that's typically the method that's being used for analyzing Legionella bacteria. It's performed by collecting a water sample, filtering it, and then culturing it where Legionella bacteria, viable Legionella bacteria will grow, and then we'll be able to identify counties and and count them. And then those results are performed in CFU per milliliter or colony forming units. This is the method that's recognized by the CDC. There are other methods that aren't recognized by the CDC, such as PCR testing or rapid testing. However, with these other methods, they don't give you the opportunity to identify between live and dead bacteria, but you can get results faster than you can with the live culture method. The live culture method usually takes 10 to 14 days. And with these PCR results, you can get results within 24 hours. So usually we see people using this as an option in an outbreak situation. You would take a PCR sample, get those results, and find out either there was potentially Legionella bacteria in this water system, or it was non-detect, and then you can rule out which areas you need to focus on. So why verify and validate your water management program? This is data that's coming from the CDC, and what they did was they looked at evidence from outbreak situations, and they looked at facilities' water management programs and determined that at areas where there were water management programs and there were also outbreaks, 43 of the places had no water management program in place. 40 of the facilities had water management programs that were implemented, but they had deficiencies in them. And then 17% of them had WMPs that had content deficiency. And so what they determined is that all of these deficiencies associated with the outbreaks could have been prevented by having a comprehensive, properly implemented water management program in place. And that's why it's essential that you're validating and verifying that your water management program is effective. Outbreaks can lead to illness and potentially death. So a properly implemented water management program could be the matter of saving lives. And when we're looking to respond to positive results, ASHRAE Guideline 12 in the 2023 version, the most recent version that's been released, does have recommendations for limits to follow. And for your potable water, they're recommending taking action at levels greater than 1 CFU per milliliter. And then in your utility water systems, your cooling tower water systems, they recommend responding at levels greater than 10 CFU per milliliter. Anything less than 1 CFU per milliliter, according to ASHRAE Guideline 12, is considered to be controlled level of Legionella bacteria. And the CDC released their toolkit following ASHRAE Guideline 12, and in the toolkit, they're following the recommendations of ASHRAE Guideline 12, but the CDC also states that there are no safe levels of Legionella bacteria growth. That's including even if the detection is less than 1 CFU. So we recommend taking action at any level, even if it's below that ASHRAE and CDC threshold of 1 CFU per milliliter, because we don't know what concentration of Legionella can potentially cause illness. And ultimately it is up to you and your water management program team to decide what mitigation strategies you want to implement at what level of detection. And in ASHRAE Guideline 12, they do have recommended responses. So for samples that are less than 1 CFU per milliliter, they're recommending that you review your collection method and make sure that your equipment is functioning properly. And then when you start to see levels above that action limit, greater than 1 CFU per milliliter, you want to ensure that your water management program action items were implemented as intended, perform that verification process. And then also they recommend evaluating physical and chemical characteristics of the water source, reviewing any maintenance procedures that have happened, and potentially considering remedial treatment after that, depending on the levels that you have and depending on how widespread the issue was. And then they do recommend that you resample at least 48 hours after you've implemented this corrective action to confirm that that was successful and that you've remediated the issue. When you're looking to respond to positive results, there are a couple other standards, regulations that you can look to as well. And this is if there is not an outbreak in the facility. So in the absence of an outbreak, the facility should take action depending on the percent positivity that you're seeing in the domestic water system and also what level it is. OSHA and the CDC have guidelines based on the level of detection. OSHA recommends taking action at levels of greater than 10 CFU per milliliter in cooling towers, and the CDC recommends taking action at any level. Point of use filters could be installed for use at specific faucets or a shower head if that area has a positive Legionella result. And in the presence of an outbreak situation, you do want to follow the directions of your corresponding health department. So when we're talking about short-term remediations, here are some actions that can be taken if you're to get a positive Legionella result. So you have a couple of different options. You can do a chemical shock or a hyperhalogenation, use point-of-use small micron filters, do a thermal disinfection, and do flushing. And when we're talking about a hyperhalogenation, what that would mean is doing kind of a shock and increasing the chlorine level throughout the facility. Most of the time, this requires you to bring it up to a level higher than what the EPA requires, that 4 parts per million. And so this can be extremely corrosive to your plumbing system. It can be disruptive to patients because during that time, you can't use the building's water supply. It can be costly because it's labor intensive at every single outlet throughout the facility. You're going to need to flush that and get back down to that below the EPA limits, and it's temporary. This is only going to be a short-term fix because most likely the Legionella will recolonize. Point-of-use filters are a good option. They are very effective at filtering out Legionella bacteria, but they do need to be changed on a routine basis. Most of them have a 90 or 180-day period, and so you would need to make sure that you have the labor that's changing those out on a regular basis, and they don't carry a disinfectant residual, so those are only effective at the fixtures where they're being installed. For a thermal disinfection, this would be raising the temperature on your hot water system to be above the temperature of killing Legionella bacteria, so either above 140 or above 158. The CDC no longer recommends doing a thermal disinfection for a short-term remediation because they found that it was temporary and Legionella bacteria did recolonize very quickly. It also, similar to a hyperhalogenation, it can be disruptive to patients because when you're at those high temperatures, the hot water system can't be used with the scalding potential. It's also labor intensive because, again, you're going to need to go throughout the entire facility and flush all of those fixtures, and it can be costly on your infrastructure. Pipes and valves and plumbing seals can fail with those high temperatures that you would be using. And then lastly, we're looking at flushing, and this would just be flushing your building's water system, opening up all the outlets throughout the building water system to increase the amount of water that's moving throughout your facility. It can help minimize sediment and biofilm, and it can decrease the water age and potentially increase the disinfectant residual that you're seeing throughout your building water system. Keeping in mind, though, that you can only increase it to the point of whatever the municipality is delivering, that level that they're delivering to your facility, that's your limiting factor. You won't be able to see a higher disinfectant residual throughout the building water system without adding some sort of supplemental disinfection system. So if you're seeing a really low level at the point of entry, then most likely you'll see a low level throughout the building water system. And then if you're finding that you're consistently getting positive results, at that point, you might want to consider a long-term remediation method, doing some sort of supplemental disinfection system. And there's a couple of different options. Chlorine can be used and added to your system as a supplemental disinfection option, increasing the chlorine level throughout the building's water system. However, we have seen that it can have effects on taste and odor and can be corrosive of your plumbing water system. Copper silver is another option that some facilities are using, but it's you can only use it on the building's hot water system, and it has a very strict pH restriction of 8.0, and it has lower dosage limits. So sometimes if if you're still seeing positive results and you're at those higher dosage limits, you don't have any potential to increase that. Chlorine dioxide can be implemented, but it does degrade very quickly, and it's not effective in hot water systems. It does not carry well in hot water systems. Monochloramine is also something to consider. It's an effective long-term solution. It's used as a disinfectant residual in many municipalities. 1 out of 4 people in the US have monochloramine in their drinking water. It has low levels of disinfection byproducts than chlorine, and it can hold well in your hot water system. And it's less corrosive than the other options that are listed here. So it's a good option to consider if you're having issues with Legionella bacteria. So taking a look at what we discussed today, we first went over Legionella bacteria and biofilm overview, talking about what types of sources you have in your building water system have the potential for Legionella bacteria growth. We went through what the latest water management program regulations and standards are, talking about those new regulations for New Jersey, and then going through Ohio, Illinois, New York City, and New York State, and also talking about all the water management program standards that are out there. We discussed what steps you need to take to create an effective water management program per ASHRAE Standard 188 and ASHRAE Standard 514. And then we talked about what some potential response or remediation strategies are. And thank you very much, everyone, for joining us today. I think we've got time for some questions now.
We sure do. And you know what? I feel bad that you had to do all the talking because you missed some great chat. So
that's okay.
Back and forth. So anyway, I'll start from the top. And really good question. Do you have a risk assessment tool for hospital water management that you could share?
Barclay performs risk assessments, but we would come on site and perform the risk assessment. The CDC does have a risk assessment tool that you can use from their toolkit, and I can find the link to that and share it with you.
Great. Also kind of tying on to that question was also, how often should the water management team meet? Do you have a recommendation, or does that vary by facility?
It varies by facility. What we usually recommend is if you're a larger hospital, more than 200 beds, and have a couple of different buildings, there's a lot going on, a lot of high risk patients, we would recommend that you meet on a quarterly basis. But if you're a smaller facility, maybe less than 200 beds, still a hospital, we would say meet on a biannual basis. And then for your hotels, your nursing homes, long-term care facilities, I'd recommend that those meet on an annual basis to update and review the plan. And then you could meet more often if as needed.
Okay, great. And so this next section here, I'm going to kind of read. It's maybe you can have some additional input, more of a conversation with some questions. But in the hospital world, isn't the water management team run by the infection control nurse, lead infection control nurse? We did have some comments that one lead is a plant ops director that reports to the IP team quarterly. That's in Illinois. I mean, have you ever seen some consistency there, or does it really vary by facility?
I would say it varies by facility. The majority of the time, we do see that its facilities or engineering department is the team leader of that, because they're the one that would be implementing a lot of the action items. They're taking the temperatures of the hot water heaters. They would be performing the flushing a lot of the times. They're doing, taking a lot of times working to take the samples. So since they're so involved and so aware of the building water system, a lot of the times I see them as taking the lead and being that team leader. And then infection control, though, is always involved in the water management program team.
Okay, excellent. There's also, for those of you that haven't been following along in the chat, Patsy put in a link for an additional live culture method called ASTM method.
I'll take a look at it.
Yeah. So, and then also comment, I think, good to remember that if you add secondary disinfection, your building may become a consecutive system to the drinking water utility, depending on your state's rules.
That's correct. Yes. You may need to become a public water system, and there might be additional requirements that you need to meet depending on each state.
Each state. And then there's another question from Lynn. For a cooling tower water management plan, what actionable item is most often used for ASHRAE 188 section 7.2.6, the disinfection of cooling towers and condensers, low chlorine or positive Legionella result?
The question is what is requiring it?
Yeah, what actionable item is most often used?
I believe based on it, you would be responding to a positive Legionella result. But I'll have to read that one again.
Okay. And how do you know the results of measurement in a state? That might need more clarification unless you know that.
Yeah. I would need more clarification on that one.
Another question that I have, maybe you've got some more insight than myself and everybody on the phone here, is, we've got New York, New Jersey, Ohio, and Illinois. Are you aware of, I'm assuming other states are thinking about having their own regulations. Are you aware of anything coming up?
I'm not aware of anything coming up right now. We've seen regulations in Pennsylvania. California had some that they were looking at. I can't think of any other states off the top of my head, but there's nothing that I think that's in progress right now. We expect that there will be more, but as of right now, nothing on the horizon.
Okay, and let me check chat and Q&A here real quick. Oh, one other question. In your experience, so you've been to 100 surveys, you've seen a common theme or a common problem that could consistently be addressed and resolved?
I would say the most common theme that we see with facilities is increasing flushing. There's so many facilities that you go to and they'll have, that one mop sink that's somewhere that nobody's been using, or it's now kind of acting as a storage closet, or with their shower heads, leaving those up, so they're not draining. So just little things like that, increasing flushing and taking the time to make sure that you're, moving your building's water system and not allowing for any stagnant water.
All right. Oh, another question just dropped in. Is there no federal law for water quality measurement by each state?
The EPA has requirements for public water systems. They do. But as far as a supplemental disinfection system, when you're adding that supplemental disinfection, that goes by state, if it would require you to become a public water system.
Gotcha. Okay. And then, yeah, everything else is kind of coming in. You have to check out the chat when
I'll have to read it.
Yep. Some really good chat in this one. I'll give everybody about another half a minute to see if there's any additional questions. Yep, I think you covered it well. Spencer. Thank you so much for your time and a wealth of knowledge.
Thank you. Have a great rest of your day, everyone. Thank you for joining us.
Everybody have a great rest of the week and have a great weekend. Thank you.